to open with this. Jeremy Hunt claimed this week that he underfunds the NHS so the taxpayer gets good value for money. Now, only a Tory could come up with that. Now, take a moment, remember this, and let's go through some of what is happening to our NHS. I speak for my profession and our NHS when I say that it's on its knees. Last year, the Tories decided that they would remove the bursary for nursing, midwifery and associated healthcare professionals training. Instead, the Treasury at that time, George Osborne, thought he would please his rich mates by charging students to work. Yes, to work 2,300 hours, if not more, long days, nights, weekends, bank holidays, longer terms. The Tories replaced our bursaries with loans of up to £64,000 in London and £52,000 out. Student nurses will pay approximately £26 an hour in London to show compassion and care to each and every one of us in society, to hold our hands through times of pain, to comfort us through loss, to watch patients go out of the hospital after helping them through a life-changing operation, to get a tissue and hold a family member who is heartbroken at loss. The student nurse who takes these memories home in their mind and never forgets their patients. The idea behind this, the Tories claim this will increase nurses by 10,000. It doesn't take a genius to work out this is not the case. Only a Tory could come up with that. Nursing should be for those who care and not for those that can afford to do so. At the same time, the Tories decided to introduce nursing on the cheap. We're going to see a nurse associate role, which will have nurses trained in the hospital. Nobody knows anything else about this, but they're rolling this out pretty soon. Yet another short-sighted decision without a single thought of the implications on patient care. The nurse associate will apparently fill the gaps and lessen the pressure on the nurses, and I think we all know what this means, creating a cheaper workforce which will replace the degree-educated nurse and cheaper to sell off. Only a Tory could come up with that. It's not just the students who have been ravaged by Tory austerity in the NHS. A perfect storm is being brewed up in nursing. Since 2010, all staff have suffered a pay loss of 14% because of the pay restraint. Again, next year we will have 1% offered to us, and I speak for my colleagues and myself to say this is simply not acceptable. Nurses are using payday loans, hardship funds and working extra shifts up to 80-hour weeks just to be able to get by. What is most shocking is the increase in nurses using food banks. One RCM member commented, "I'm constantly worried about how I will put food on my table. We've already cut down on essentials like fruit and meat. I apply for food parcels for my patients while at the same time wishing that I could have one for myself." Our post-registration education funding has been cut, our safe staffing has been cut, our agency spending has been cut. As a result, we don't have time to go for a break or even to go to the toilet some days. These are the harsh realities of nursing. We get completely ignored by the government. They do not listen to our concerns. We have a 24,000 shortage of nurses. The RCN Labour report found that 10.4% of nurses left last year, with only 8.9% coming in. Above 40% of our nurses are heading into retirement. It's not only us that have been under attack. The junior doctors have fought hard to protect patient care. Their contract, to put it simply, will see them work longer hours, spread more thinly, and wards close as a consequence. And yes, less pay. People think that doctors get paid thousands, and I can tell you that this is not the case. Chronic underfunding is making our jobs beyond challenging. Trusts are in huge deficit. The 10 billion pledged by the Tories is a complete fallacy. Our A&Es are packed, ambulances run down the driveway. If we have patients in the department for more than 4 hours, which is about 60 times per day in each department, we have to pay £120 per patient. The increase in patients in A&Es comes as more and more close. Sustainability and transformation plans, which you may have heard of, are going to close services in our area. In London, we're going to go from 9 hospitals down to 5. When you have a bed manager who calls you and asks you to get a bed now and you don't have one, well, where are these extra patients going to go? Only a Tory could come up with this. And our overstretched community nurses, which I'm going to be, see daily the effects of our government's austerity measures on patients and their family lives. Elderly patients living with dementia live alone. Social care has been cut by £1 billion. We go and we see them once a day in a 10-minute slot, which we always overstay, and give them their medication. We're the only person that patient sees that day. They're lonely, they're scared, You imagine how that feels when you close the door behind you knowing you're the only person that they see that entire day. We try our best, but right now most of us, because of austerity and chronic underfunding, feel that our best is not enough, that we have failed. Tears are too common amongst healthcare professionals right now. Who would want to be so undervalued? Who would want to be so disrespected? Who would we want to make to feel like a banker is more important than you? We don't ask for much, we just ask for a little bit of respect. All of this isn't coincidental. Our NHS is being set up to fail so the Tories can sell it off piece by piece. But there is hope. Jeremy Corbyn has always stood by the NHS. He has valued and appreciated every single one of us. Who was it that stopped to speak to me on the street about the student nurses' bursaries? Who was it who tabled an opposition debate for us? Who was it that pledged to renationalise the NHS? Who was it that stated they would give us a well-needed pay rise? Who fights daily austerity which plagues the lives of my patients and families alike? Who is the one that gives us a bit of respect? Only Jeremy Corbyn is exactly that. So I think it's essential that we take the fight to the Tories now for the NHS, which I was thrilled to see Jeremy Corbyn do this week in PMQs. I think it's really important that the Labour Party, and I will call them to do this, to do an NHS day of action before it's too late. But we can't just leave it to Jeremy Corbyn. We must all take a role in fighting to save the NHS before it's too late. Please join in your local campaigns, find out about things that's going on around you. Join the People's Assembly, which I'm in, and help us build a bigger movement. And I ask of you, please support the nurses. The Royal College of Nursing have launched a pay campaign because we simply cannot continue. People say the nurses won't, this union won't, that person won't, but actually, if we say this, it becomes at the risk of being a self-fulfilling prophecy. We need to get behind each other and we need to empower nurses to know that they can fight back and to save our NHS. We've got money for Trident, money for war, money for royal boats, money for runways, money for trains, money for private planes, money for £13 million to be spent on MP's wine. And Jeremy Hunt thinks that underfunding the NHS gives the taxpayer value for money. Thank you.